All right, well, thank you, Governor, for joining me today. I appreciate it. And first off, Happy New Year. And I
Happy
want to
New
get
Year.
started here with the most prevalent topic. Obviously, we're still in the middle of the pandemic, and the vaccine, good news that we have it rolled out before the new year. And now I know we were expecting another 250,000 doses to come through last week or this week. Have we gotten that second shipment from Pfizer or Moderna yet?
You know, we get notified every Tuesday about what will be sent the next Monday, Tuesday, and Wednesday. So there should be additional vaccine arriving today and tomorrow, and in all likelihood on Wednesday. Our goal is really to get this vaccine out just as quick as we can get it out, and you know that's working well. As of this morning, we'd vaccinated I think 161,000 people in Ohio, and we really started with people who are the most at risk, and that, of course, is the people in our nursing homes. Over half the people who have died in Ohio from COVID have been from nursing homes. So we're over 60% done with our nursing homes for the first shot. We got to go back for the second shot. By the end of the week, we'll probably be at 80%, and so we're moving along quite well with the nursing homes. One of the concerns we have, though, is we're only getting about 40% of the staff so far that is taking the vaccine. Now they'll get a second chance when we start on Friday with the second doses. Some of the early homes that we get now will start getting a second dose, and those staff will have another opportunity to get it. But we just urge them to do it. It's really for their protection. It's for the protection of the people in the nursing homes.
And as you mentioned that, I actually had a call before I came in here today from a woman in Ada, concerned for her mother, 96, with dementia in a nursing home, and the nurse that treats her does not want to take the vaccine. Now, I know you've said it's not your call to make nursing homes enforce their employees to get the vaccine, but is there anything else you can do that would urge them to get the vaccine?
Well, we certainly have been working on that. What we have found is that the nursing homes that have provided videos and other good education to the staff and to the residents, they get a much higher percentage of people who will take the vaccine. What we think is some people are just kind of holding back, you know, waiting for a few weeks. And what we really need to remind them, though, is that, you know, they're not going to get another chance for a while. For example, the people who work in nursing homes, they're going to get a chance in the next several weeks. But after that, it could be quite a while before they have the opportunity to get the vaccine. So we really just want to urge everyone who has the opportunity, when you're given the opportunity to get the vaccine, take it. It really is a lifesaver. It's also kind of your passport to get your life back and to get starting at least to get back to normal.
Can you say what might be the hang up without getting the vaccine here rolling more smoothly?
Well, I think it's rolling pretty smoothly as far as us getting shots in people's arms. I mean, we're doing, for example, our local health departments are doing a good job. They're getting it out to our EMS. Some of the congregate care settings they're taking care of. Our nursing homes, as I said, are moving along very well. So our hospitals are also moving along pretty well, and you know we're moving forward. But we hope to get more come into the state. You know, we now only have 2 kinds of vaccines that are coming in. Every week we get shipments of those vaccines. But as you've read, in Great Britain, they've approved a third vaccine. So we would hope that would be approved in the United States. We would hope we would get a fourth and maybe even a fifth vaccine. And when that happens, we're going to see more vaccine flowing into the state of Ohio. We can't control what comes in, what the federal government sends us. They're allocating to all 50 states, and it's a scarce commodity. But as that stream gets bigger, then we're going to have more opportunity to get people vaccinated faster. We hope in a couple weeks to be able to move to people 75 years of age and older. And we're very excited about that because besides the nursing homes, the biggest indicator of death or possibility of death, or what increases the possibility of death, is just age. You know, it just goes up dramatically. By the time you get 65, 70, the numbers go up dramatically. And by the time you get 80 or 90, it just continues to go up. So getting those individuals vaccinated as quickly as we can is just really imperative.
Turning attention now to House Bill 6. It seems the General Assembly was not able to get anything done before the new year. The new General Assembly is coming in today. You have spoken that you want that House Bill 6 repealed. How do you want to see it replaced?
Well, I think first of all, it needs to be repealed because what we now know about how it was passed is just not good. You know, the stench from it is not good, and we have to kind of reverse that, start all over again. But my policy positions have not changed. I supported it. I think it's important that we protect nuclear energy in the state of Ohio. We got a lot of jobs at stake, but we also, it accounts for 85 to 90% of all our carbon-free energy production in the state. So to turn our back on nuclear at this point would make absolutely no sense. So I hope that the General Assembly will work something out so that we can continue to have nuclear, but they'll kind of go back, do a reset, start over again, and consider it anew.
Representative Householder, who backed this House Bill 6, back in the General Assembly now, where do you stand on if he should stay, if the General Assembly should have him removed?
Well, he's been elected by the people of his district, and they knew when they elected him that he was under indictment. So that's a matter, of the General Assembly. I think, frankly, what we have to do is let the legal process now play out. Let the system work. The system generally works pretty well. We're a nation of laws, and let's let that system work out.
You have another bill to worry about today, Senate Bill 175, dealing with Stand Your Ground. Have you given thought on what you might do with that bill now?
Well, I have, but I'm not ready to announce it yet. We'll be announcing it a little bit later this afternoon.
Fair enough. Moving on, you, just as everyone else in the state, we are big, crazy Buckeye fans, and with the national championship coming on Monday, have you given any consideration to keeping bars open or any sort of fashion of that?
Well, I certainly get that question. It's a very fair question. And first of all, congratulations to the Buckeyes. Congratulations to the Cleveland Browns. Very happy with both. Congratulations to UC. They did well. But here's where we are. We are at a very high rate of exposure in the state of Ohio. And there are many people who have urged us to close bars. Many people have urged us to close restaurants. In fact, a few months ago, Dr. Birx was in here from the White House. Her recommendation was, based on the cases that we had then, is that we should close them down completely. We have not done that. We've taken kind of a middle-of-the-road position. We now have a 10 o'clock curfew, so obviously all bars and restaurants have to close by 10 o'clock. That seemed to be a compromise where we could, allow them to continue, but, cut off a period of time when generally in bars, it is more difficult to have a distance. People drink and they drink more, and their inhibitions go away, and it's just more difficult. That's just human nature. And so we thought at 10 o'clock, that's a rational place to draw the line. Not perfect, but seemed to make sense based on the data and the importance of keeping people separate and apart. So, I wish we weren't where we are. We have a very high rate today. And, every county in the state, we have 88 counties, of course, and every county is at least 3 times what the CDC considers high incidence in the last 2 weeks. So we have some counties that are 10, 11 times that. So we're not in a good situation. We're asking a lot of people to make sacrifices. We're asking, for example, fans of high school basketball. We've cut down on the number of people who can go in these gyms because we know that the spread can occur inside in gyms. And the problem with bars, it's not the fault of the bar owner or the people who work there. It's not the fault of the restaurants, but by its nature, you can't drink and you can't eat with a mask on. And we know that the mask is really what is protecting people so much, and it's really cutting down on the spread of the virus.
And sticking with sports, the Cavs have allowed a couple of fans to come to a couple of their home games. Down the road, do we see that happening for the Blue Jackets, Ohio State basketball, Cincinnati basketball, and all the colleges across the state?
You know, what the health department does is they take these on a case-by-case basis. In regard to the Cavs, they made a very compelling case to the health department that they have a very good ventilation system, a new system. It's a system that circulates air out of that big arena frequently. And so I think that when I talked to the professionals at the health department, that was one of the reasons that they allowed any fans in. But having fans spread out is good. Having fans wear masks is good. But being inside is still just different from outside. We've had, for the Browns and for the Bengals, we've had a 12,000 person capacity, 12,000 people cap on that. And, you know, that's about 1/5 of the number of people that can be seated there. So it allows people to spread out, allows people and families to be together. People wear masks, and it's outside. And so that's really, we think, pretty darn safe. When you start going inside, it's tougher. Even if they do a good job, it's still tougher.
Lastly, I want to look at the national stage now. You had an interview on Sunday morning regarding the election and the Republican Party and some representatives and senators wanting to block the election results. And then later that day, we see that there was a call between President Trump and an official from Georgia. Has that changed anything for you? Do you still think Republicans need to back off to approve the election results?
I think we need to analyze where we are. 4th day of January, 16 days until a president gets sworn in. So we're very, very close. We've already had every state, all 50 states have certified their election results. The electors have met, the electors have voted. The courts have been open. There have been many lawsuits that have been filed. None of the lawsuits have been successful to overturn any of the results in any of the states. And so unless there is some brand new information that is very compelling, I would expect Congress to do what Congress has done since this law has been in effect back in the 19th century. And that is to approve what the states and the voters of the states have provided. I was in Congress in 2005 in the U.S. Senate, and the Democrats were trying to do the same thing. What they were trying to do is knock out Ohio's votes, and we didn't like that. We thought that we know what we're doing in Ohio. We ran a good election, and to override the will of the people, to override the certification, I think is a very, very, very high bar. And so I would not expect that to happen.
And just like in 2005 and today, it could be considered wrong that they would stop the will of the people.
Look, it doesn't mean that our system is perfect. There's problems with it. I think it's time. Senator Portman has an idea about putting a commission together, not to look at this election necessarily or to try to change the outcome, but to look at the big picture. How do we protect our votes? How do we make sure they're secure? And look at it from a national point of view. I think states candidly can learn something from Ohio. We validate when people are applying for an absentee ballot, when they're applying to be able to vote at their own home and mail that in, there has to be some validation of that. And you have to request that ballot, you have to ask for that ballot, you have to fill out the form, there has to be a validation. So it's that type of discussion that I think would be a good discussion in the country, and maybe come up with some best practices or best standards that every state would need to follow. So there's work to be done, there's things that can be done, but to overturn an election when we've had 50 states certify it and the courts have been open and lawsuits have been filed and no court has overturned it. In fact, the U.S. Supreme Court has refused to take that action. I think we are where we are. Even those of us who voted for Donald Trump, I was one of his co-chairs, and wanted him to become the president again, but that's not what happened.
And this is behind the theory that there was widespread voter fraud, which no one has found, like you mentioned, even in the courts. And just for reassurance, we have not had any in Ohio, correct?
No. I mean, look, are there mistakes made? Sure. But we've not seen any evidence that has been brought forward that would indicate that there is of such a magnitude of fraud that it would overturn the entire election. We just have not, we have not seen that, nor have we seen it to overturn what has gone on in any state. And the courts have had the opportunity. I mean, we're a great believer in this country in the rule of law. We might not like the outcome, but we're a believer in we take our cases to court. If we lose, we appeal it. If we lose, we appeal as long as we can, but at some point there's an end to it. And again, unless there's some new evidence that's coming up, I would not expect Congress to take the extraordinary thing that's never done before, and that is to override a state, override the voters of a state.
Well, thank you, Governor DeWine. That wraps up all of my questions. And again, I appreciate you joining me here today.
Have a good day. Appreciate it.
Thank you, too.